at the end of the day, your customer or your product, or however you care to think of it, is your patient.
Yes.
And they're the ones, you think about some of these people in these leadership positions, and is this how they would want their mother, their brother, their spouse to be treated? If the answer is no, and the thing is it's not that anybody wants to be apathetic. It's that there's so much empathy fatigue that you can't get around it. It's not that you don't want to, it's that you can't. And the patients are the ones that ultimately suffer.
Yes. And it's leading us to a lot of nurses like myself have decided to leave the country or the province. In my circumstance, I left the province. I started in New Brunswick, went out to British Columbia, and now I'm currently in Nova Scotia. And listen, at the end, before, in all fairness for me, before I became a nurse, while I was in nursing school, I remember the calling on my heart was like, I need to do travel nursing at one point. I've been seeing it. I've been wanting to try it. And it's something that I've wanted to do for a very long time. So for travel nursing for me, there's a little bit more of a heart-to-heart story about it. It's just something that I really wanted to do for a very long time. And it's just, the timing couldn't have been more perfect given the upside down flipping of our healthcare system in Quebec. And it was just time to, life just put me onto this path. However, when it comes down to travel nursing in other provinces that I've seen, there are issues in other provinces. Nowhere is going to be perfect, I will say that, but I do have to say that Quebec takes the cake, sadly enough. And at one point when I was on social media during the pandemic, I did become a healthcare expert in the pandemic in Quebec when it came down to talking about COVID resources and whatnot. And one of the things that the conversation became less and less scientific, and how can you help your counterparts, or how can you help your family, your friends to not get COVID, and how do you isolate and all of those types of things. It became less and less that conversation down the line, and more political. And when it became more and more political, it became more and more bashing of the healthcare system. And there's a little, and I'm, as much as I did say what I said about our healthcare system and the bettering that it requires, I do believe that there's still redemption in that. I do believe if they see it for what it is now, if they see, listen, your issue is not just your budget that you have and how you're managing your entire healthcare system. The issue is that you're also not looking at the people anymore. And I'm here to talk about that component because I am been a victim of burnout of the healthcare system. I've been a victim of burnout in other circumstances, but the system is far one of them that has drained me to the ground. And I've seen healthcare professionals do that. I've even seen nurses get strangled on the job. How is this even allowed? How is this even getting that to that magnitude or getting that close? And we're wondering, we're just going to put them back in a system and not come up with better solutions. And this is not an institution issue. This is a government issue. This stems up higher because this is not the first time ever. This is not a one institution issue. This is a multitude institution issue. Nurses in Florida. There was a nurse that got brutally attacked. I believe. I think it was Florida, brutally attacked. These things happen everywhere. And we're wondering why our nurses are quote unquote bitter. Why are what changed after the pandemic? Because we have been working on nothing.
Yes. I actually appreciate you bringing up the violence against clinical professionals thing, because that's on the rise here too. And that's completely unacceptable. Completely. But unfortunately, because the empathy isn't able to come down to the patients, often they are also unable to give empathy back the other way. Because when empathy works well, it goes in two directions. Well, right now it's not going in either one.
Yes.
It's a big roadblock. And I shouldn't say that. I mean, that's a blanket statement. But in my experience, that seems to be more true than not.